say I'm a Republican for Chet Edwards. My biggest concern is about 10 years ago we decided that we had enough money that we'd worked hard for all of our lives. We ran a business 40 some odd years, and we sold the business, took the money, and moved to Johnson County 10 years ago, thinking we had enough money to last us. With Social Security, we did make out pretty good, and then the economy really turned sour. The insurance companies started raising the prices, our taxes started going up, our everyday bills, our utility bills went out of sight, they're still going, and now that the Social Security said there will be no increase next year, and yet we've had substantial increases in our insurance, our taxes, and our utilities. The utilities are running ramshot over us, and I'm really sick and tired of being able to be put down by these money-making leeches that get after us and take our money. I want to know if there's anything that you can do to stop some of this. We didn't really intend to pay or to exist on Social Security, but we paid Social Security. We're in our 80s. We started paying Social Security the day we went to work in the 40s. And we paid it all those years, and now they tell us that they can't help us anymore. Well, the VA says that they can't help me either very much because Social Security is paying us too much money by maybe $50 a year or so. I don't know what it is. But we're right there on the borderline, and they can't help us either. We don't really want charity. We're not going to ask for charity. But with the market the way it is, and the way the prices have gone up on our insurance, on our taxes, and on our utilities, we're not going to make it. It's over with. It's all gone. But you don't see the elderly out there complaining or standing in the breadline. But I'm telling you, we're going to be broke, and our houses are going to be gone. And we're going to be on the streets, and we're going to be dependent on government aid. When it comes to home health care, the federal government is doing less and less and less, and they're kowtowing to the major caretakers of the United States. It's getting to the point now if somebody on Medicare needs some help in their home care, they've got to pick up a telephone, and they're getting somebody in New Jersey or New York or California who could really care less about them locally. The local dealers can no longer stay in business, no longer help them, because Medicare and the federal government is not helping them. There have been a lot of abuses in Medicare, there's no question about it, but I will say this, I have been in the Medicare business, or in the healthcare business, selling to dealers throughout the United States for over 40 years. I have seen 99.9% of those dealers were all honest citizens. And now we have just a few bad apples who are billing, and they're the ones that they're getting on fraud. And quite frankly, with my mailing list of 1,400 people, these people that are being charged with fraud, first of all, I can't pronounce their name. Second of all, I've never heard of their business as well as I'm into it. And they pick on the honest people who are trying to give compassionate home care. They're giving them the axe. And it's coming to the point where we're going to have one bank, one insurance company, and one home care company, and it's going to force a lot of these recipients of home care back into the hospitals, and here we go again. Frankly, my insurance has just gone out of sight. We can't afford it anymore. But now you say we can keep our private insurance. How wonderful. We love our private insurance. We've got AARP and Medicare, and we get along with them very, very nicely. But their prices, including Medicare, continues to rise. And so now that I can keep my private insurance, but I can spend another $1,800 for those people, like the lady who was on television the other night, what am I going to do with my 8 children? And she can barely speak English. Now, if you want to see a tide coming across the border, we cannot stop the tide. If we have free home care, or free medical care for everybody who comes across that border, and we can.
May I address your comments?
And the hospitals can't turn them away. Now, maybe we can't give them or help them, but the hospitals cannot turn them away by law.
Several points. The most important thing I want to say in my answer to you is we're awfully blessed to live in a country where great citizens such as yourself risked your life to save the world from Hitler in Japan in World War II. So it's a son of World War II veteran. And on that point, let me say, it's been one of the greatest privileges of my life to co-chair the Army Caucus, to represent it for 14 years, the largest Army installation in the world, and now to chair the VA and Military Construction Appropriations Committee. On veterans, one of the things that you addressed that's a real problem, there are a lot of veterans, World War II veterans and others, who have served this country admirably and made a difference not just for our country but for the world. And yet they're making $30,000 or a little above that, and if they don't have a service-connected disability, they don't qualify for VA health care. That income cutoff for veterans to get VA care has been frozen since 2003. Last year, I wrote the law to increase that income threshold by 10%. And if this works, we'll try to increase it again, to try to open up the door of our VA hospitals to a lot of great Americans, such as yourself, sir, who earn the right to get that VA care. And I wish you would talk to our Cleburne office next week about, we're giving them Labor Day off, and talk to them Tuesday or Wednesday about whether that income cap increase might have qualified you. There are a lot of veterans in our district who last year didn't qualify for VA care, who next year will qualify for VA care. The other thing I would say is, you talked about some of the cutbacks in Medicare. The greatest threat to Medicare services for seniors, is if we don't do something about these fast rising costs in health care. It's going to bankrupt the Medicare budget and put services to seniors at risk. One of the good things in this bill regarding seniors is that if there's no change in law, there will be a 21% cut in reimbursement rates to physicians who provide care to seniors under the Medicare program. Talk to your physicians. If that goes into place, you may have your Medicare card, you won't be able to find a doctor anywhere who will take on any new patients in the night. So this bill, whether we do it in this bill or separately, we got to stop that automatic 21% cut in Medicare reimbursements. If we can hold down some of these cost increases that are affecting the VA healthcare system and Medicare, by getting people out of emergency rooms and into primary care doctor's offices, which are sometimes 1/10 the price of someone walking into an emergency room. If we can have some of the health insurance competition and reform we've talked about tonight, if we can pressure the drug companies to make concessions, and they supposedly made $110 billion of concessions to reduce drug prices for seniors, I'm hoping we could make a positive difference for seniors and others such as yourself. And I would say you might be an example of the kind of person who would be hurt if we implemented the suggestion of some in this room that would say, let's get rid of Social Security and Medicare. I think my father died when he was 90 last year. He worked till he was 89. He loved working. He never was on welfare in his life. But had it not been for the Medicare program, Dad, because of expenses in the last 5 to 6 years of his life, would have lost every penny he ever saved. He died as a middle-income working man, like most families in this district. So thank you, sir, for your service. We've got to protect the long-term financial viability, the Medicare and the Social Security system. Thank you, sir.
Dan Hunt, where's Dan? You're asking the next question. Let me go ahead and pull the name of the person who will talk after you. John Downing of Cleburne, please get in position. You'll be the next one up. Mr. Hunt.
Thank you. Mr. Edwards, I first want to thank you for coming here tonight. And I know I appreciate you coming and facing the people, and some of the people in the crowd are hostile. And I'll tell you, I'm probably one of those people. Before I go any further, though, I do want to thank Victoria Sykes, your office manager here in Cleburne. She does a fantastic job for you, whether I support you or not. She does a great job. Some of the things you mentioned so far here tonight, one of the gentlemen over here asked about this health care plan covering illegal aliens. I'll point out page 50.